Welcome back. Health and Human Services Secretary Robert F. Kennedy Jr. is planning to lay off at least two-thirds of the staff at the National Institute of Occupational Safety and Health. It is the federal agency within HHS that attempts to prevent workplace-related injuries and illnesses. Those firings are part of the 10,000 jobs that are expected to be cut across the agency. I want to bring in former White House Coronavirus Response Coordinator Dr. Deborah Birx to evaluate all this. Dr. Birx, I'm so glad you're with us. You have vast experience in the federal government and the federal bureaucracy. How do you read these reductions within HHS? Some people are expressing tremendous alarm. Where do you fall on that spectrum?
Well, I was in DOD, HHS, state, and the White House, 41 years in federal service. And let me just say, my federal service colleagues, I worked with a lot of dedicated, hardworking people. But what has happened over the years that you're not hearing about, you're hearing about fraud, waste, and abuse, but there's something else that has been going on, and that's a lot of duplication among the HHS agencies. And so when COVID hit, you had things that were ASPR was doing that also CDC was doing, and it caused a lot of confusion. And I think what they're trying to do, and which I hope they are trying to do, is bring back fundamentals, stop the duplication, get people remission focused, and hold people accountable to improvements in Americans' health, because we're spending more. We have more personnel, about 17% increase in just the last 4 years, yet the health of America has not improved. And so I think we have to get back to really understanding what is the job of HHS, and that's the health and human services of the American people. And I hope that's what is going to come back in this focus.
As you read the headlines, as you talk to your colleagues still in, do you think that the process that is going on is moving in that direction, or is kind of pell-mell and sort of, well, let's just cut as big a number as we can think of?
I see the work at HHS being pretty deliberative. The fact that they put ASPR back within the CDC, so that CDC, who is also working on disease control, is doing the same thing as ASPR so that we're ready for the next pandemic. Because when you have two agencies thinking they're both in charge, it caused a lot of confusion around that table of trying to get the best job of COVID for the American people. And so what I'm hoping comes out of this is a much more horizontal structure where the NIH, I just say, being at CDC, there are 150 different databases, none of which talk to each other. So there's an injury database, there's a flu database. Americans are whole people. So I think figuring out how do we get more horizontal data so we can find where things are going well and learn from them, and the things that aren't going well in specific counties, particularly rural counties who are well behind in life expectancy compared to urban counties. Are we doing something to address that? And then holding the federal government to outcomes. The job of the federal government is not to analyze data. The job of the federal government is to use data to find solutions to actually improve outcomes and impacts.
Dr. Birx, I want to ask you about something that's going on at FDA, because Peter Marks, who, as you know, was the FDA's head of biologics, resigned. And in his resignation letter, he said Robert F. Kennedy Jr., who leads the Department of Health and Human Services, is subservient. He seeks subservient confirmation of his misinformation and lies. That's a direct quote related to vaccines and their effectiveness. And the Wall Street Journal recently editorialized that Mr. Kennedy rightly criticized the Biden administration's COVID response for ignoring science, but he won't restore public confidence if he feeds skepticism about vaccines that have saved countless lives. The Wall Street Journal editorial board writes, "Our worst fears about Mr. Kennedy are coming true." Do you share any of those anxieties?
Well, what I've seen on the ground, because I've been working the last 4 years in rural Texas, is really him coming out and saying, I believe in the MMR vaccine. It is effective. I want people to get it. He supported CDC to go in there and support increased access to vaccination. Federal dollars went to increasing vaccination in that area. So, you have to look at people's actions and really try to understand what is being said and what is being actually done on the ground. And I think what is being done on the ground in West Texas is consistent with improving vaccination rates.
Dr. Deborah Birx, I appreciate your perspective. Thanks so very much.
Thank you.